Don Williams again for the Institute of Sports and Spines. Today we're going to demonstrate some forearm exercises. Commonly we get people come in with complaints of tennis elbow and golfer's elbow. The technical terms for these are actually lateral epicondylitis and medial epicondylitis, because the medial condyle is essentially the origin of the flexor group of the forearm. The lateral epicondyle is the origin of the extensor group of the forearm. So when you look at tennis elbow, the mechanism of injury is often from a lagging hand when people are doing lifting activities of, say, bags or suitcases and things, or on their holidays, or when they're undoing bolts and nuts and things. In tennis, it's when people are a little lazy with their wrist and the racket head drops, so as they strike the ball, they get force over what they're normally accustomed to at the origin of those tendons, and so it gets strained and inflamed. So when we want to exercise these muscles, we want to try and isolate the forearm so we're not getting a bicep exercise. So in this environment, we use Theraband. Now, Theraband's a nice cheap thing that you can buy and take home and replicate these exercises in a home environment. It doesn't really matter whether you use tube or banding. They really do the same thing. It's just in certain circumstances, a tube will be simpler. In certain circumstances, a band will be simpler. For forearm exercises, I generally say that tubing was a little bit easier to use, but it's not significantly different. So essentially, to do the flexor group, start with the arm supported, let the wrist flex or extend in the full position, and then bring it into a flex position. So just repetitions just like this. To do the extensor group, we start with the palm facing down. So the wrist is now in a fully flexed position. We bring it into the extended position. These should be completed for maybe 2 sets of 10 repetitions. As you get better, you want to slowly increase the resistance of the tubing or the banding that you use. At the same time that you're strengthening the muscle groups, it's probably important to stretch them as well. So some simple forearm stretches for the flexor group: get the elbow straight, pull the hand into an extended position, and then slowly pull the fingers into the midline so you're externally rotating the shoulder and forearm. To do the extensor group, you can take the hand into a flex position and slowly overpressure, and then internally rotate the arm. When you're doing the extensor group, you can also form a fist and do the same maneuver, and it will tend to bring the stretch down further towards the wrist. That completes our demonstration today of forearm strengthening and stretching exercises.